I keep seeing practitioners plant their flag on one side or another, declaring that only cannula or only needle is the correct way to treat lips. I'm here to give my take on it. Firstly, if the injector lacks experience or skill, either method can ruin your lips. The hand that holds the syringe matters more than whether the tick of the instrument is sharp or blunt. That being said, when all things are equal, I do believe the needle technique is superior at delivering effective results in the least traumatic way. Let's firstly pick apart a few popular claims that people use when talking about the cannula technique. Claim number 1. Cannula lips are pain-free. The only reason patients feel nothing is because a practitioner has carried out a full dental-style nerve block beforehand. If you try to place a cannula within someone's lips with simple numbing cream, they won't let you because it's too painful. Also, to carry out a nerve block, you have to inject with a needle in a number of areas outside of the lips and along the gums with lidocaine. These injections are painful and usually more painful than a needle used for lip filler. Typically, 1 to 2 ml of lidocaine solution is used, and this causes the lips to swell, and it also eradicates the resting tone of the lips. So now the practitioner has to carry out an artistic treatment on a swollen and effectively dead pair of lips. Once the anesthetic wears off and the swelling disperses, the lips look quite different to what the practitioner had created during the treatment. Claim number 2. A cannula will cause less swelling. No, it won't. A cannula is a blunt metal tube you have to thread backwards and forwards, causing blunt dissection of lip tissue. That shearing of tissue will create just as much and likely more swelling than 7 to 10 microneedle injections. Claim number 3. A cannula reduces the risk of bruising. This is somewhat true. The frequency of bruising is less, but if you do nick a vessel, the severity of the bruise is often more severe. The bleeding will track the entire length of the cannula and is more likely to result in those big bruises that cover half the lip. With a needle, you're more likely to see pinpoint bruising that isn't as noticeable and resolves a lot quicker. And lastly, claim number 4. A cannula is safer. Yes, a blunt-tipped instrument is less likely to enter into an artery, but it's not impossible for this to happen. When a cannula does breach a vessel, it sits inside that vessel for longer and delivers a larger bolus of filler before a practitioner can realize. So the rate of occlusion is less, but the severity of an occlusion is usually worse. Needles and cannulas both carry risk, but with good understanding of anatomy, both techniques can be done safely. A cannula is an excellent tool we have available in aesthetic medicine. They excel at covering a large area and allow even distribution of filler. Common areas I'll use cannulas include the jawline, corners of the mouth, and under eyes. Lips, however, need millimeter precision. Defining a cupid's bow, adding vertical height, lifting the corners of the mouth. This is all done best using a fine needle. Yes, gifted specialists can produce lovely lip results with a cannula, but when you compare like for like, a fine needle is favorable, and that's why many of the world's best injectors, including Arthur Swift, Raja Quilla, and Julie Horn, still rely primarily on needles when treating the lips.